Stroke. Time is critically important. The quicker a patient gets help, the less likely they are to die or to suffer permanent brain damage.
And the standard is the golden hour, 1 hour from symptoms to treat. But as Wink News health and medical reporter Amy Osher shows us, a company headquartered right here aims to beat that clock.
Every month, more than 24,000 stroke patients from around the U.S. are connected with a neurologist through Fort Myers-based telespecialists, bringing expert treatment to the bedside in virtual visits.
With teleconferencing, we can be there immediately, work with doctors and nurses on the ground, and give that care very quickly because time is brain. As the blood flow to that part of the brain is diminished or stops, brain starts dying very, very quickly.
Founder Nima Malzoun saw an opportunity to assess patients even quicker, putting them within the ideal 1 hour window so doctors on site could deliver clot-busting meds, essentially stopping the stroke. Telemedicine is now commonplace in stroke care, but by using a specialized iPad-type device, they believe they can push the envelope and shave precious minutes.
One thing would be to get the patient with the physician, so get the physician in front of the patient before they even come to the hospital. So how do we do that? Well, let's work with ambulances.
A pilot program is now underway in the Tampa area, including a stroke specialist on the ride to the hospital.
We would log into the ambulance and start evaluating the patients with the EMT at bedside. So now we know who the patient is, we know what they have. As soon as they come to the hospital, they can get their CT scan of the head and get the clotbuster medication.
What seems like a small tweak can make a world of difference.
Potentially, these patients can get the clotbuster medication in less than 5 minutes.
Shortening the clock increases the likelihood a stroke patient can go home whole and healthy. Amy Osher, Wink News.
And a big hurdle was overcoming privacy laws, allowing those doctors to assess a patient's medical records in the ambulance. They accomplished this by creating a secure network. We'll be right back.